If you're working in MedTech and are struggling to make your devices more sustainable, then there's a link in the description for you. Our guest today is Maximilian Hofmann. Maximilian is a sustainability manager at Raumedic, a leading component manufacturer and CDMO for medical devices. In the last 4 years, he established sustainability management systems, ISCC-PLUS certification for 2 sites, and introduced eco-design guidelines into Raumedic's development process. Despite all efforts, sustainable products are struggling to take off in MedTech. And in this podcast, we want to explore why we have these current challenges in sustainable product development. Here is our discussion. Hi, Maximilian, and welcome to the podcast. So you are a sustainability manager now for 4 years for Raumedic. What have you achieved in these 4 years? Tell us about that.
Hello, Lucas. Nice to meet you and nice to be part of your podcast. Well, yes, I'm the sustainability manager from Raumedic, and in the last 4 years, we achieved a lot of different stuff and a lot of different points. One of them, I would say, is our ISCC-PLUS certification in 2 of our main or 2 of our biggest plants, and the other one would be also our first sustainability report, or also building up an energy center for renewable energies. So a lot of things have been done, and yeah, we are looking into a good future, I would say.
Okay, so you bet on mass-balanced plastics in your case. Was it challenging to achieve the ISCC-PLUS certification? Because that depends a lot on how your processes work. Some companies take a year, some make it in 3 months.
I would say Raumedic as a manufacturer for pharma and medical devices, who are based on silicon and polymers, I would say it's quite easy to achieve ISCC-PLUS certifications. But overall, of course, you have to implement something. But when you have this high regulation area for medical devices and in the medical field, I would say you can handle the points from ISCC-PLUS quite good.
Okay.
So it shouldn't be such a strong task for everyone.
Okay. So everybody is just like a lot of times just how do you say that they're just running in circles, but it's actually not as hard to achieve if you actually focus on the essential.
Yes, absolutely.
Good. So you can introduce, or would you introduce Raumedic a little bit and their products? What kind of products and services do you offer, and what is your technical focus, let's say?
Well, Raumedic produces some products for the medical and also for the pharma sector, and all our products are based on silicon or on polymers. And there is not the one product from Raumedic. All the things we are producing are highly customer focused and also made for our customers specially. So we don't have this one device for all of our customers. We are developing our products especially for the customer needs. So when a customer have a problem and they need a solution, they come to us and we go with them through the whole development process, and we can create the best product for them based on their needs. Most of the time it's a tubing, some sets. Most of the time it's tubing sets, injection molding, some other parts. And here we have a wide range. So starting with normal tubing and also tubing for internal devices like catheters or something like this. All these points are possible, or all these products are possible to produce with Raumedic.
Okay. So you do both injection molding and extrusion and some assembly, I assume?
Yes, also assembly. So when we have some tube devices or some bigger sets, of course we can also assemble them.
Okay, so you're let's say a typical CDMO, so a contract manufacturer that basically does all the physical stuff of producing a medical device, and then in the end, would you also do packaging and sterilization, like until you have the final device, and then the customer just needs to do the regulatory approval and the sales?
Sterilization on our own side, no, but we have also partners who can do this. So when a customer comes to us and he need a product which is sterilized and so on, we can offer this with another partner together. So that's possible. and not a big problem.
Okay, good. And as we already teasered, you have quite a strong focus, and you're very vocal on, let's say, social media such as LinkedIn about your capabilities in supporting your customers in making more sustainable medical devices. Would you like to tell us about that?
Yeah, because this is one big puzzle part for our big strategy. So first of all, maybe we go a little bit a step back and we figure out that when we talk about emissions and we talk about sustainable products and also sustainable value chain, we have to talk about scope 3 emissions also. And when we look in our value chain from Raumedic itself, we can figure out that Raumedic itself is only responsible for around about 10% of the emissions. Most of our emissions are coming from the material we are buying and also in the end of the life sector when we burn our medical products or when the medical products will be burned. So it's quite clear for us, if we want to have a change on the value chain, we need to change our products and we need to change the products from our customers to have here a real impact. And together with long development times, and when we look on climate targets and so on, it's quite clear if we want to have this sustainable product in the future, we have to start now, not in 5 years because it's too late.
So how did that go, that you came to this conclusion that sustainability needs to be part of your strategy and needs to be part of your, let's say, value offering? How did you come to that conclusion?
Well, in the beginning, we start with a lot of workshops together internally and also with our customers. And the main idea was in this time, what can we offer on the sustainability side and also what can we do for internally. And it was quite clear that we need to have such a product in place to have a real impact. It's just a question of what is a real impact on the value chain, what is a real impact on our whole economic side, and it need to be a product. Mm-hmm. Because here we have the strongest impact overall. Of course, we will purchase renewable electricity and so on, and we will work on these topics as well as we did in the past. But the big point is our product and will be our product.
Mm-hmm. Okay. And basically, where did that come from? Did that come intrinsically from you, from your management, because you think this is the best long-term strategy? Or was it more of a customer-driven decision?
I would say a little bit of both. First of all, of course, a lot of customers have the need for sustainable products. We have European regulations, we have economy and also EU taxonomy targets they want to achieve. And on the other hand, also from internal side, we want to bring a product to this market and also deliver solutions for these needs. So it's a little bit of both, I would say. And of course, with a lot of sustainable requests from our customers, also we bring up a lot of solutions. But in the beginning area, I would say around about 3 to 4 years ago, it was not so specific. It was more like from the customer, here we have this product, can you do it more sustainable? Whatever this means, just tell us, can you do it more sustainable? And we say, oh yeah, of course we can. Here have a look for some biopolymers, ISCC-PLUS polymers or something like this. What do you want? And then we come in discussions and then it's going a little bit more in detail. But yeah, in the moment, I would say the customer now knows much more than in the past, and it's also more clear what they want. But in the past, it was just like, can you do it more sustainable?
Yeah. So that's also my experience. So over the last, I would say, like 5 years, MedTech is a little coming of age. What the sustainability topic is there. There is, and I always like to tell this joke. I think I didn't tell it too much on the podcast, so I will repeat it this time. It's like sustainability and medtech is a little like teenagers and sex. It's like everybody's talking about it. Everybody wants to do it, but nobody really knows how it's actually done. And I really like that joke because it's funny, because it's true. It's some of them really know how sustainability is done and what targets they have, and they have actual eco design guidelines. They have a strategy, how they want to go about design for recycling and stuff like that. And then there are the other ones that are like here and come to me and say, yeah, I want to make my products more sustainable. Please tell me what sustainability even means and what that, what should I do to be more sustainable? That's just like the most common request. So, and now you have quite the experience in like working with customers. You've built the eco design guideline, as we talked about. You have ISCC-PLUS certifications. But as we already teasered, there is like, let's say, there's a challenge of these products really taking off and getting to market. Why do you think this is?
Yeah, that's quite a good question. I would say one of the main points is that CO2 in the moment doesn't have a price bed. So all what we need, or the biggest problem is that sustainable products are directly, on the same table as non-sustainable products. And this lead to the big point, what is cheaper and what brings the most profit. And this is exactly the point where I would say the medical area or also the pharmaceutical area, we have this problem a little bit that CO2 doesn't have a price in the moment, or not the price that it should have. I would say I experienced that some customers start with this point and they say, okay, when we are talking about new developments, when you save us 1 ton of CO2, we can give you some price for this or some price on the product level, of course. But this is really rare. Most of them say, okay, when you offer us a product, please offer us a sustainability version and a non-sustainability version. And in the end, most of the time, it's a question of the price.
Yeah. And have you made some experiences on like if there is any surcharge that the customer is willing to pay? Is it like if you offer 2 versions, what's the premium that the customer is usually willing to pay?
This depends a little bit on the location of the customer. I would say in Nordic countries, they are more willing to bring up some money on the table for a sustainability version. When we talk about more from the Asian part or from Asian customers, I would say on this area, the whole topic sustainability is there, and we see that they wake up and they have a lot of different ideas. But on the price level, we cannot see this behavior. So yeah, I would say our best possibility is the Nordic market with Sweden, Finland, and so on.
Okay. And do you think sustainable products always have to be more expensive? If you're working in MedTech and are struggling to make your devices more sustainable, then there's a link in the description for you.
No, and this is also one good point, I would say, because in the past, sustainable products were really, really more expensive. So we talk about double figure percentage areas. But in the moment, ISCC-PLUS materials, for example, are getting more and more into the market, more and more common. Prices reduces. The difference between one product and the other one are going much lower. And I would say in a few years, they are nearly on the same level. And also when we talk about sustainable products in medical area, this product is not for one shot only, I would say. I mean, in the end of life area maybe, but when we produce such a product, we produce this over a long time. And it's quite clear in the moment, maybe it's not the most economic point, but when this product runs for 3 or 4 years, material prices are going a little bit more lower on sustainable products, then we have this break-even point where sustainable products will be more cheap. So I would say when we start now with the development of sustainable products and it's in production, we have a good chance that they are this time cheaper than the fossil alternative.
Mm-hmm. So your advice would be get on the train now, develop your devices now, because like in a few years, materials are going to get cheaper. The demand is going to go up from your customers, and you're going to have a strategic market advantage. Is that what you're saying?
Yes, and also on the market, also on the price side, I would say You have a better position when you talk about European taxonomy goals and also CO2 reduction goals, and also on the price side.
Mm. Okay, so I am going to insert a little rant here because I need to correct the. I mean, I still do it myself, but I try to refrain from doing it. But I'm just gonna go out with it now. So the word sustainability has like degraded a little bit into the meaning ecology. So sustainability means for many people, sustainability just means ecology, so better for the environment. But if you look at the definition and how it was meant, so that sustainability has three pillars. And the pillars are economy, ecology, and social aspects. In a medical context, this means it's good for our pockets, so we can make profit. It's good for the patients, so we are compliant and safe and functional and help people live better lives. And then in the end, it's better for the environment. And only if you have all of those, then you can be successful. And then I think it's the best long-term strategy you can ever have, because I think there's no objection to it. And a lot of the eco design principles also drive out a lot of the cost and unnecessary cost. Sometimes you have materials that are completely over engineered. So like somebody has a mechanical component, and what do you take? It's like, I only know one high performance polymer, and that's PEEK. So I take PEEK, and that's very expensive. And it's also very CO2 intensive. And maybe a PA6 would have been completely sufficient. But we've always done it like this. It's on the market. It's approved. We don't change it. And if you start to tackle those, I think you can drive out also a lot of cost. What's your take on my rant?
Yeah, this brings up a really, really good point on the table, I would say. And also from European regulation side, that saving lives is not sustainable in their definition when we talk about the medical sector. And so, yeah, this was also some point we are thinking about. And I would say you are absolutely right. There are more dimensions, and also we have to focus on the other dimensions. And it's also quite clear that in the moment, everyone is focused on cost, and also on the only environment side. Everybody is talking about CO2, social targets. Nobody is talking about this.
Yeah.
This is our most experience. So when you save the CO2, social targets must be quite also okay. No.
Yes.
Yeah. So I would totally, go with your point and say, yeah, that's correct.
Yeah. And those points also like kind of correlate or influence each other. So if you drive up cost, and you would say like CO2 is our only measure and we want to reduce it at any cost, we just increase the cost of our products to a like double digit level. So everything is 50% more expensive now, and we save a lot of CO2 using like alternative plastics. And then what happens is like healthcare spending increases, and then like the spending on everybody increases. So either the taxpayer or the patient has to pay. Someone has to pay for it, and then in the end, like healthcare, either healthcare needs to make a lot of savings, so not everybody gets the care that they need, and there we have the social aspects. Or you just start to increase taxes, and that also puts a burden on everybody. So like the economic and the social, they are interconnected, and also the sustainable, the ecology and the social aspects are connected. So if you start to pump out a lot of toxins into the environment, and or you start to use a lot of land and water, those also have social implications. So it's like we have to start looking at the thing holistically. Also, something that I like to talk about is like a lot of people want to do multi-use or reprocessable medical devices. But then you have like in the end, the user, which is healthcare professionals or surgeons, they have to basically reprocess that somehow. There has to be a process in the hospital to do that. You have to have collection systems and all that stuff. And nobody really thinks about how it's actually done in detail and who would do what and what the stakeholders really need. So I guess the point is we have to be more holistic with looking at the whole system and not only at our little garden and how we can improve our little garden.
Yeah, That's quite a good point. And that's also the point why I start in the beginning with our view on the whole value chain and not only on ourselves. And this is also the idea where we're coming from, and where I coming from, is that we have to think about the whole value chain. And it's quite true that in the end, what happens with our products in the hospitals and so on, this is also a big question mark. And how can we handle with this? And that's the point. And of course, we have to talk about this. And yeah, we also had some ideas about recycling and recycling products and what can we do here in this part. And here again, we come quite fast to the problem that when you put out the material from the hospitals, you have a lot of volume, a lot of mass of polymers and so on, but not the big amount of mass. So you have maybe just 5 kilogram or something like this, but 1 cubic meter of a packet. No, not in total, but to have a little bit a picture in mind. And of course, you also have to put this on a truck to a recycling place or something like this. How do we handle with emissions on this part, or also social aspects, other aspects with our product on this point? And this is, I would say, one of our biggest tasks for the future. We have to change our whole business and our whole business idea, medical and pharma sector, and how can we do this? And of course, we cannot forget in the end the patient, the most important person overall. Yeah. And this is also what we write down in our red line, which just means creating sustainable value. And sustainable value is more than cost or economic.
Yeah, it's also about helping patients, because that's if you're not helping patients, you have no justification doing MedTech. It's just as easy. I mean, with the recycling topic, yes, it is like that if you have plastic waste that comes from a hospital or from anywhere, it's a lot of volume and not a lot of mass, because usually it's packaging, usually it's tubing, and those have thin wall thicknesses, which is also good because like you save a lot of material. You can package a lot with a little plastic. And then in the end, you have the challenge that this takes up a lot of space and you do not have a lot of weight. I mean, my take on this would be like, it's worth it to put it in a truck and put it to incineration. So we could also put it somewhere else. So currently, like the infrastructure for incineration is there. You just have to repurpose that infrastructure. And instead of incineration, you need to do some decontamination and then afterwards see what plastics still can be used. I think the biggest challenge is like, how do you decontaminate without completely shredding the plastic to bits, so to say, in a chemical way? So what you usually would do is like hot steam sterilization, and not all plastics support hot steam sterilization very well. Like the high performance plastics, they do not care, but there are plastics that will just like start to shrink or start to degrade, and then like the quality is not even there anymore to do something with it. That's a challenge. What other challenges do you see like with the whole adoption of sustainable products in the market? Do you enjoy the podcast? Then subscribe and rate it on your platform, and join the discussion on LinkedIn. Your feedback and comments help us improve the podcast and bring relevant topics to you. Let's form a better world with plastics.
Well, I would say also the big point when we talk about medical regulations in total. It's a whole development time, and from my perspective, what we have is that when you develop new medical or pharmaceutical products, nobody really thinks about on regulation side about the point where you want to change something. And this is exactly the point what we have now. We have a lot of products in place where we say, okay, our customers, the patients need those products, and we have a lot of ideas how we can do it better. But the point or the way to change a product which is in the market is quite a long and also very expensive point. So I would start with the point that I would say, okay, and when we think about new medical regulations or changing regulations, we also have to think about change management, which is more easy. and more on our side, that we can bring changes in place, not in decades, maybe in 1 or 2 years. This would be quite good.
Yeah.
And of course, quality and also security for the patient must be number one. This is overall, of course, but there are a lot of things when we say, okay, it's not really related to the patient or to someone else. It's just a small change. Nobody really would notice. But if we start to do this little change, we would have to do tons of works and so on. And is it really worth? And I would say, yeah, it should be worth. This is also on regulation side something I would wish that they would change.
Mm-hmm, mm-hmm. I mean, I think the biggest challenge, and that's like a bird eye view, a topic, is that Europe does not have a central agency. I don't believe that I say that because I'm a very free market guy, and I am not a fan of a lot of state power. However, in the US, they have the FDA, and the FDA is like the whole and only authority on how medical devices should be brought to market. And I saw this a post one day, and I think it very, very well illustrates how the difference between a notified body in Europe, which is a private organization that gets audited from state bodies and has to check if the MDR requirements are met. And then there's the FDA. And there was like this comparison. FDA says, look, your medical device that you want to use in this clinical context did perform these tests. But in that context that you're using them in, we suggest that you do these tests because we think that they are important in that clinical context. Please do them and then come back. And then the notified body is there and says, your chapter so-and-so in your technical documentation is not according to chapter so-and-so in the MDR requirements. Please change the documentation. And, you see the difference. So one is just the letter of the law, and the other one is the spirit of the law. And sometimes like the spirit of the law is more important than the letter of the law. And Europe is very much letter of the law type of regulations. It's like it is in the MDR, and if it's in the MDR, it's the Bible basically. You have to adhere to it because there's no possibility that the MDR didn't cover everything. And it's only 200 pages. It's 200 pages, but in 200 pages you cannot put like everything that is ever possible in the world. So if a rule is stupid or does not apply, you have no possibility of ever like ruling, yeah, in this case, it's okay. Because the notified body will get judged by the state bodies, by their auditors, if they do not perfectly adhere to the letter of the law. And I think that's the difference. And I think that is the big challenge. I hope that, I think the train has left for the whole system. I don't think that the notified body system will go away so soon. I think it would have been better if they have like a medical device agency in Europe, because then at least you can have a judge that can judge your case and say, yeah, it's okay in this case because spirit of the law thing. Yeah, I think that is the biggest challenge. Then the other challenge is that a lot of companies make it more complicated than it is. Sorry for the second rant here, but I'm kind of getting into it. Like you have 5 people that are like the department heads that need to decide on something. If you want to make a change, like product manager, then you have the development head, and then you have like a bunch of other people that are involved and are going to be affected by the change. And then you have this change committee. Then you discuss like half an hour, should we not do the change? And then we do not know what implications the change would have. And then you task a team of like 3-4 people, and then they come back in 2 weeks. They make an assessment, and then you have to discuss the same points again. It's like how fast you can make decisions and how that is implemented and how lean you can do that. That will really help you. And the bigger the organization, the more opinions, the more heuristics, and the longer it takes. So like a pharma company is able to like deal with itself without output for I think years before they do anything. It's like that's really my experience. I think if you are like a small and medium company, this is the only advantage you have. They have the money, they have the market access, they're the dominant ones, but you can make quick decisions and fast projects. That's the only ace you have. yeah, maybe some comments on your side, because you're the guest and you should be talking actually.
No, quite good. Maybe just on your first point with the European Union or with the European regulations, I would nearly say the same. Or I guess it's the English phrase which hard cases make bad law, and European Union really decided to play this game to the end, from my perspective. And I would nearly say the same. You cannot deal in regulation with every point. I mean, we are in Germany, it's also a little bit the same. Some other parts of the European Union can handle a law in 20 pages. We need 680. Everything else is not possible. Yeah, so I would say they all should focus more on the target and not on a way around, maybe a little bit. So what is the most important point? Customer safety, patient safety on medical devices, and how can we ensure this? And in the end, the paperwork behind is one point, but is it really necessary to talk about, oh, you sent this document in this piece of paper? Is this really okay? Yes or no? Maybe. I would say in the end, also companies should have their own responsibility for what they are doing a little bit more.
Yeah,
not totally free, but also a little bit more in this case. And we have the same on the energy market, on medical, and I would say here, or I would agree here totally with you. And also, it is a little bit the same with inside the company. Of course, when you are growing, like Raumedic, you build up the structures behind it, and it makes things a little bit more complicated. When you are smaller, it's more easy. And from my experience, also with big companies, it is like you say, you have a lot of people on the table. Everyone wants to make their statement and want to thumbs up and say, okay, it's okay, but nobody really want to make a decision. And this is the big problem. Everyone want to be involved, but in the end, you have no decision. And decision-making process is, I would say, not only in medical sector, overall, one of the biggest problem. We need more decisions, and also that we say, okay, when we have this decision, we work for it. And of course, on our way to the target, there are changes. We cannot think the whole chain onto the last detail, and then the best plan, and on second one, it goes all down the drain because something changes. So we have to really think about this. And yeah, for me and myself spoken, I'm a person who like to have a decision and to follow a target, and not to be more focused on the problems, more focused on the solutions.
Yeah. And I think that is like a cultural thing. It's a company culture thing. Yes, because as you described it, it's a lot of people want to be involved because like being in meetings all day can justify your salary, basically. So I'm there, I'm needed, so I justify my salary. But do not take decisions that will cost you your salary. That is like the ones that you like the most. They are here because they think they're needed and contributed, and their opinion matters. But nobody really takes a decision, because if you take the wrong decision, it could cost you your job. And I think if you have a culture where you like say, okay, make a decision on the best data available and risk-based approach. Say, what's the worst thing that can happen in an unironic way, and say, yeah, okay, worst thing that can happen is someone dies. Yeah, probably not a good idea. Worst thing that can happen is we do it again and we lose 2 months. Yeah, okay, come on, let's do it. Because like the upside is a lot better than the downside. And that is also comes down a little bit to what I think is knowledge gaps. So sustainability, as I already said in my rant, is often framed just as ecology. And that is one barrier, because people think it's like, yeah, we're just throwing out capitalism now and profit doesn't matter anymore. And you just want to make us less money and save the planet for it. And that's not the case. And then secondly, like regulatory requirements is a phrase that is 80% of the people that say regulatory requirements, if you go one step deeper, they have no idea what they're talking about. That's a little mean, but if you're going like, yeah, we want to use recycled plastics. Yeah, but you can't do that because of regulatory requirements. And I'm like, yeah, which ones? And then they're like one step further is probably, yeah, it is in the MDR. And I'm like, okay, cool. Which passage, which exact position in the MDR you're talking about? And then they're like, I don't know. Okay, go look, go read. And then you see MDR says only material. That's the only thing the MDR says. Has to be safe, has to be effective, doesn't have to have like CMR substance stuff in there that is toxic. But else, there's no requirement that says you can't. It's just technically very difficult to do it. And so my favorite provocation is there are no regulatory hurdles to use recycled plastics. There are technical ones, and those are difficult. Yeah, and I think like these knowledge gaps, those are the biggest hurdles. What do you think about this?
Yeah, I would say the same, because yeah, to bring up a problem to the core, or to dig a little bit deeper, of course it's necessary to talk about these things, and of course there are a lot of phrases in every business sector, I would say, and say, okay, it is not possible because of something like this. And when you're digging a little bit deeper, then, or maybe it is possible, but it is other reasons. As you said, with recycling plastics and so on, from my perspective, the real point behind is a little bit more the process stability, and that you bring up every time the same or in the end of the line, from product quality and so on. And this is a good point. And of course, it would be good if the people would be here a little bit. Is open-minded the right word? I don't know, but open for innovations is maybe a good point. And maybe a good example for this is that I have written a few years ago, I guess 1 or 2 years ago, in the Netherlands. They also started with the first recycling plant from tubes. I guess they are PVC tubes with blood on it, and they can recycle it. A few months earlier, I've heard, yeah, it's totally impossible. Must be burned. Impossible. You open up the newspapers. Netherlands. Last time I look on the European map, it was part of the European Union. Obviously, it's possible.
Yeah.
But yeah, and this is also, I think, what we have to learn in Europe in general is a little bit more open-minded, searching for solutions, and also don't fear the pain of digging deep into a topic. And this is, I guess, what a lot of people have: fear the pain to go deep into the topic.
Oh, I want to frame that quote. That is brilliant. That is brilliant. Thank you for bringing that up. It's like people avoid the pain of digging deep and being like the first who does something, because you could burn yourself. That is like the genuine fear of people that are shy of these innovations. And I think like if you build the confidence, if you build the knowledge and the competence to know your device in and out, know the clinical in and out, know your customers in and out, then you can go for like these innovative, difficult, challenging solutions such as recycled plastics, because that like the physics of it is not easy. And physics is basically the law that you have. Like you can't just change physics on a whim, but like if you can't figure out how to do it like technically, that is that brings you a lot of value, also a lot of learnings. And I think sustainability and innovation go really hand in hand. A lot of people think it's a marketing exercise or a compliance exercise, but I think it's really, sustainability is about innovation and long-term strategy.
Absolutely.
Yeah, so I would like to go over to the more personal part. What makes you so passionate about sustainable medical devices?
Yeah, this is also quite a good point. I mean, what makes me passionate about sustainability or sustainability in whole, I would say, it's a little bit the point that I am the last generation in my home area who learned skiing here. So last time we have snow is quite a little bit more years ago, and it's quite clear I was the last generation who learned to ski. And maybe in 30 years, again, we will all have a barbecue on our Christmas markets and so on. And this makes me a little bit worry about and also think about the point of sustainability. And sustainable medical products in total are quite interesting from my perspective because this product itself helps people to survive. So it's good. Check. And everybody needs it. Nobody wants it because when you need it, you have really a big problem, but it's quite good to have it. And yeah, to change this products or to make them more sustainable is overall a really interesting task. On the one hand, it's not easy, and when it's not easy, every success feel as a real success on personal side. Every time when you achieve something, that's quite good. And I would say to make a good thing also sustainable, and to make good things sustainable is something when you go home and you don't ask yourself what have you done.
Yeah. So it's about purpose. It's not that
Yes.
I make something that people would. It's questionable if people actually need something like that. So like a fidget spinner or something like that. That it just like, yeah, it's entertaining, but you really don't need to have it, and make that more sustainable. But something that is life saving and that is already good in its purpose, and then make it even better by making it good for the planet and also profitable.
Yes.
Very good. Very good.
I
So,
would say it like this, yes.
Maximilian, I always give the chance to our guests to give an advice to our listeners. So what advice would you like to give in the area of sustainable medical device development, let's say?
In one sentence, I would say don't give up.
Very good.
It is worth. And in the end, the task is quite big, and I would say it is worth overall. And don't stop starting. Every time when something fails, start again. Just do it.
Okay. Just do it. I think that's the Nike slogan, isn't it?
Yeah.
Just do it.
But fits quite good here.
I have my own take because I wrote it down, I think just yesterday for a educational program I'm doing. It's like, I said it there, start with the easy projects. Don't stop with the easy projects. To build your muscle, you need to start with low weight and then progressively add more until you have big muscles. And that is the same thing with sustainability. You start with something that is easy because you can't handle anything other than that. And then you start increasing. Don't start with the easy ones. You just like have to, as you said, dig deep into it and endure the pain. And at some point, you're gonna be like so much ahead of the market that you can't even believe it. So, if you have, do you have any last words, Maximilian?
Yeah, I guess I would say in the end to everyone, don't lose the hope. And as we said, never stop starting. And for this, I would turn the clocks a little bit back to the year 2015 when the climate protocol or especially the Paris Climate Agreement started. In this world, we had path which it looks like we hit the 4.8 degree future. In the moment, with all our actions we have taken, it looks like we hit a 2.7 degree future. So even if it doesn't look that happened so much, it happened. And every impact counts, also on medical devices, or especially here. And I would say, yeah, this is worth to fight for.
Okay. Thank you very much for your insights, Maximilian. This was Maximilian Hofmann from Raumedic, and until the next time.
See you. Bye-bye.
If If you're working in MedTech and are struggling to make your devices more sustainable, then there's a link in the description for you.